Hello, my name is Crystal Martinez, and today I'm going to talk to you about telehealth and its relation to healthcare informatics. Our overview for today is to go over telehealth and its definition, some of the ethical issues that may arise with telehealth, some of the laws, regulations, and standards associated with telehealth, and the impact that telehealth has on healthcare delivery, administration, education, data administration, and research. I'm also going to go over some of the associated data, tools, and technologies that arise from telehealth. I'm then going to go into an example that I have provided on telehealth, and then we will close. So telehealth defined is the use of electronic information and telecommunication technologies to support long-distance clinical healthcare. Some of the technologies of telehealth that exist are telenursing, which utilizes technology to deliver vital nursing care; telemedicine, which involves the practice of medical information exchange from one site to another; the view of electronic communications for e-health and/or medication refills; provides education to the patient or healthcare provider in support of improving the treatment of the patient. Another technology is e-health, also known as mobile health or m-health. This is the use of electronic information and telecommunication technologies to support long-distance healthcare, patient and professional health-related education, public health, and health administration. So first, we're going to start off by going over some of the ethical issues that may arise with the utilization of telehealth. One of the first one is fitness for purpose. So this is, does the telecare meet the broad needs of the patient? So basically, some of the ethical issues that can arise for fitness for purpose are, is this device capable of monitoring the patient correctly due to, it could be their age, it can be their living conditions, it can be their location. So this is what ethical issues can arise for that. For example, if you have somebody that is elderly and doesn't really understand the equipment, this can cause some ethical issues. Next, we have portability and comfort. So can the telehealth equipment be carried and worn by the patient based on age or medical conditions? An example for this one that can arise with ethical issues is if you have a 2-year-old that is required to wear a certain piece of equipment, is the 2-year-old going to be able to keep that equipment on for constant monitoring or correct readings? That's something that, some of the ethical issues that need to be taken into consideration. And then also comfort. If you have an elderly patient and they're required to wear, say, let's say a blood pressure cuff, is this going to be comfortable for the elderly if they are they have no mobility and they're basically sitting in a hospital bed from their home all day long? And then next we'll go into responsiveness, which is, does the equipment provide accurate responses and readings? So is this providing the correct responses that are needed for medical professionals to care for the patient? And then we have reliability and trustworthiness. Is the telecare equipment reliable? And is it safe according to the patient's needs? And then also, can the stakeholders and the medical person trust the equipment readings? So this kind of goes into, is this device that is being used in a telehealth setting reliable to provide the correct readings, kind of to avoid any serious medical conditions worsening. Maintainability can also create some ethical issues. How readily accessible is the telehealth equipment for service and repair? So since telehealth is, you're being serviced from afar, that means that the medical providers or technicians can be miles away. And if it's an item that needs accurate medical responses, let's say for glucose readings, and the equipment goes down, this may cause some ethical issues as far as getting out to the patient to get this item serviced and back to operations. And then lastly, we have accessibility. With the technology advances, We have a lot of different generations within society. So is this telehealth equipment going to be accessible for not only the patient but the medical professional? Are they going to be educated on the correct use of this device? So this is important so that we can avoid any ethical issues from arising. Some of the laws, regulations, and standards in relation to telehealth is telemedicine reports in 1997 and 2001 have identified to Congress that telehealth licensure is the greatest barrier to its development. So this creates a barrier because each state has different laws and regulations. They're not always the same as national requirements. So this can cause issues with trying to get nurses certified to provide telehealth services. So the Nurse Licensure Compact Law, as of February 2013, allows for 24 compact states that now exist. The law requires that when an RN holds a license in one of the 24 compact states, he or she may practice in any of the 24 compact states. So this greatly facilitates telehealth interactions across state boundaries. So some of the requirements and provisions of the Nurse Licensure Compact Law are that all nurses are required to pass a criminal background check before obtaining a nursing license. With the enhanced NLC, this allows for not only RNs but LPNs and LVNs to have one multi-state nursing license. This provides the ability to provide care to patients in their home state and other designated compact nursing states. Also, nurses with a multi-state nursing license can provide care across state boundaries. So this is telehealth. This type of telehealth is very important when responding to a sort of disaster that may happen in another state or across the United States, because now nurses can be on call to support. So that within the Nursing Licensure Compact Law, your primary state of residence must be one of the compact nursing states. Nurses must obtain license to qualify for travel nursing jobs in non-compact nursing states. RNs, LPNs, and LVNs are included in the compact. A nurse whose primary state of residence is a compact state can apply for a multi-state license. Nurses are responsible for complying with the provisions of the Nurse Practice Act in all states where they practice. So now I'm going to go into the impacts that telehealth may have on healthcare delivery, education, administration, and or research. So the impact the impact that telehealth has on healthcare delivery is, I think it improves healthcare delivery, because now rural communities can receive healthcare, or patients that may not have had access to a facility that could treat them could now utilize telehealth, where a nurse can monitor them daily. So this provides great delivery and access. It provides prevention of care for those who may not have had seen a doctor monthly or daily. So the education operation information is critical to ensure that healthcare is provided accurately. So it's important that within your operation that information is passed along and knowledge is, everybody is very knowledgeable on the topic of telehealth. You need to know who will be served by the telemedicine applications, what services they are receiving, are there any gaps between the desired and current delivery arrangements, and lastly, telehealth education. This is vital to the patients and their families. So care should be taken to identify cultural issues. So I think education is important because you can actually identify those cultural issues or barriers that may exist within your patients. Administration. Healthcare professionals must agree upon the usefulness and feasibility of the approach of telehealth. So this kind of goes down to when you're actually creating a vision for your telehealth setup and your design. It's important that the professionals that are utilizing the telehealth are on the same page and they know what their feasibility and what the approach they're going to use to implement this. And it also takes active involvement and support. This is key to the telehealth services being implemented. It's important to be on board and be educated on the rules of telehealth and how your center is going to operate. Some of the telehealth research that has arisen recently, it suggests that telehealth medicine may actually generate higher healthcare costs when offered as alternative to face-to-face visits. So since telehealth is so new to society, it's definitely going to be an expensive cost at first. And I think once we all get on board and it's utilized more, maybe some savings can go back into the healthcare facility and maybe they can actually cut their costs. So according to the RAND Corporation, they published in Health Affairs, analyzed the behavior of more than 300,000 people that access telemedicine services. They found that they spent an average of $45 more per year than patients without access to telemedicine. So this is $45 more a year. To me, it doesn't seem like a lot more from what services you're being rendered. So now you, especially if you're immobile or you have no transportation or you're elderly, I think telehealth is extremely important because now you can have somebody come to your house every day and you don't have to worry about going to a facility or finding transportation, or your medical needs can be met from a nurse coming to you every once in a while and just monitoring your health for prevention of hospital stays. So some of the data tools and technology goals are to develop next generation telehealth tools and technologies to enhance healthcare delivery to medical underserved population using telecommunication technology. So this could be your rural communities where there's not very many facilities around to receive medical care. Telehealth will be very important in these type of environments because now instead of traveling an hour to see a doctor for a certain medical condition, you can now get care from a telehealth nurse. It also increases access to medical specialty service while decreasing healthcare costs. So now you can have access to medical specialty services that were maybe not at one time available or not within your rural community. This can overall decrease cost because you now don't have to pay to travel. Your care is brought to your home. It's also important to provide training on the implementation process when implementing telehealth. So the daily use of healthcare providers, clinical trainees, and students in healthcare related fields. So an example of a telehealth device is a flash glucose monitoring system. This technology is critical in supporting patients with diabetes. So the Abbott Freestyle Library Flash Glucose Monitoring System is a mobile health or mHealth technology that monitors glucose levels in the telehealth environment. So the device is a sensor patch that is placed on the patient's arm, and it's vital in monitoring the patient's blood glucose levels from afar. So medical professionals can now have the ability to monitor glucose levels from afar. So this is a very good example of a preventative measure because it allows for intervention before the patient's condition gets worse. So this allows for nurses to intervene when they see those glucose levels going up before the glucose levels are uncontrolled and now the patient needs to be hospitalized because they had no access to care. So in summary, telehealth is not only a vital asset to rural communities, but also to the instant access to healthcare services. It provides so much. It provides availability, access to healthcare when otherwise not feasible. So this can be due to distance or facility availability. This definitely provides availability all the time. It provides comfort because now you can access healthcare from in your own home. For elderly patients that are not as mobile or maybe younger patients, this will help bring medical professionals to the home where it's comfortable for them to receive care. It's also great in prevention because if nurses can monitor healthcare from afar,